Perfect. Perfect. So before we'll be talking about the pack, but before that, I recognize there is a couple of SCAGO employees here, notably the well-being coordinators from different regions. So if you can just wave, say hi, and introduce which region you're covering, so that will help also people identify you. And I believe we have also some folks from the education team. So please just wave, say hi, and introduce yourself. Thank you.
I can start. I'm Samira, and I'm the Patient Wellbeing Coordinator for the GTA region. It's nice to see you all. And I can pass it on to someone else. Krithika.
Thank you, Samira. So my name is Kritika, and I'm the education coordinator for the GTA region, and I'm so excited to be here. Nice to meet you all.
Okay, and then I'll give it back to
Alistasa.
Maisa.
Alistasa is on the call. Stasha?
Is Tasha?
Yes.
Yeah, I
Yes,
think
she.
she's there. So I'm
Yes, yes.
Maisa. I'm the
Hi.
coordinator for the Hamilton region. Hi again. Who's on? Arlene is on.
Hi.
Hi.
My name's Arlene. I help with the GTA and sometimes other places. With the education committee and also I help well anyone that needs help basically. I'm community outreach. I'm not sure who to pass it to.
Yeah, Stasha, I think Stasha has her hand up.
Yes,
So
she
yeah, go
does.
ahead, Stasha.
Hi, I don't know if you hear me. I don't know why the I don't see myself.
No, we can hear
Uh,
you and see you. It's perfect.
oh, you can? Oh, sorry. Yeah, I cannot see myself though. So yes, I'm Stasha. I'm here in Windsor, patient wellbeing coordinator.
Perfect.
Wonderful.
I believe Temple is here as well, and then we can move with the program.
Might not be available. That's
Available.
okay.
Okay,
Yeah.
perfect. And myself, I'm Tanya Elise. I'm part of the peer
Sorry, I'm
support.
here.
Yeah, go ahead, Temple.
Hi, how you doing? I'm Temple. I'm the community ambassador for GT and Durham. Can you hear me?
Yes, we can
Yes.
hear you.
Okay,
Thanks,
yeah,
Temple.
thank you. Yeah.
Perfect, thank you. And myself, I'm part of the peer support committee, and I'm also part of the PAC, as you will be seeing it in a few, and I also coordinate the Ottawa Get to Know the Southeastern Ontario region. So not to take too much of your time, let's continue with the program for today. So we want you to know more. We wanted this session for you to know more about the PAC, to know what is it that they are doing, when is it okay to contact them, what are the type of not only issues, because you can also reach out when there are good news. We also like to hear that, but mainly what are the type of projects or yeah, project that PAC worked on. So PAC was established in 2021. Their mission being to support SCAGO's vision in optimizing the lives of individuals with sickle cell and to build a patient-centric culture. PAC advises SCAGO on healthcare gaps for sickle cell disease patients, recommending improvements and collaborating with Ontario hospitals. And how do we get about that? It's when we hear your stories, when people will come up with, hey, I'm facing this in the hospital. Of course, we're not advocating for personal or individual cases, but we can notice that if Tanya is saying that you're receiving this care in this hospital, Janet as well, Temple, Aileen, like we see that no, this is more of a systemic issue. That's where usually SCAGO as the organization will be aware and they can get PAC involved or the other way around. Sometimes people may reach to PAC chair and share what they are going through. And that's where those can be brought up to PAC discussions and start to be addressed as a project. And you will learn more as we go through this presentation today. So get to know because I wanted to say your, but it's our PAC is here definitely, as you will see, it's here for all of us, part of the community, whether you are a peer or a parent or a caregiver, PAC is here to support SCAGO and all of us. So very quickly, we'll go through each member, presenting you each members and a little bit of their biography so you know who they are. At first here we have Fitzanne Awell. She's the chair and she will be one of the speakers today as well. So Fitzanne was diagnosed at 5 months old with sickle cell disease. Uh, for everyone around her, sickle cell disease for everyone around her posed an issue, but Fitzanne learned that it was an obstacle to overcome. Fitzanne has been a part of various committees of SCAGO, such as the Education Committee and PAC, and has always been an advocate for not only herself, but for every sickle cell warrior out there. I believe when she will start talking, and she will say, you will see her picture all over when we're talking about SCAGO or advocating. So she's definitely someone who's here for the community. And just give me a moment. I'm just looking for Fitzanne here. I think I passed her. I would like just to pin her so that she'll be ready when the time comes for her to speak today. So thank you, Fitzanne. Next, Lance. So Lance is the first vice chair of the PAC. He's a sickle cell disease peer. He's passionate about improving the quality of life of patients with the disease. He has a PhD in clinical psychology and works as a psychologist on supervised practice, treating anxiety disorders, mood disorders, and the psychological impact of living with chronic illness. I believe you've seen a few times in the WhatsApp family group, some survey will go on. We want to hear from you. I'm working on this. I want to learn this about the community, that lens. So it will come because he's hard working on research for the community and improving the care for sickle cell disease patients. So I'll do the same and pin on the call today. Next is the second vice chair, Marie Oduwole. Marie is an academic foundation in biochemistry and environmental chemistry, leveraging her expertise within the realm of consulting. A devoted mother of two, she holds a personal stake in sickle cell disease due to a family member's battle with the condition. Her fervent interest lies in advancing the SCAGO mission, aiming to broaden awareness of sickle cell disease across Ontario and beyond. So Marie is an active member of the PAC, bringing some exciting projects where we'll be talking about projects. Some of them was brought by Marie, and you will learn about all that in a few minutes. Make word to talk about myself. So Tanya, I'm the PAC secretary. I support PAC as a secretary for a few years now. I'm a mother of three and caregiver to a child diagnosed with sickle cell disease at birth. I passionately support the sickle cell disease community through various hats, including the Southeastern Ontario chapter lead, advocacy via the PAC, and French translation. I've also done some French translation for SCAGO. I hold a bachelor in human resources and a master's in project management. And I do my best to support the community for the best of my abilities. Next in the call is Jane. She's a PAC voting member. She is a proud mother of three. Her youngest has sickle cell disease. She has completed a bachelor's degree in sociology, holds a paralegal license, and works as a family peer support. As a mental health advocate, she is vastly interested in exploring mental health, codependence, and stigma it relates to sickle cell peers. So Jane has supported the Ottawa region before actually I step in as the coordinator, and definitely bringing idea or how we can support the community with mental health as being one of her involvement. And also you'll see her, those who are from Ottawa, when we have events, peer support events, she's always there to cheer the community. Kamisha. So Kamisha is a PAC voting member as well. She is a patient advocate dedicated to serving the sickle cell disease community, a member of the Meet the Parent at Sick Kids. She enjoys providing families of children with sickle cell with information on resources to support them. She also volunteers at the Toronto Caribbean Carnival's King and Queen Show, raising awareness of sickle cell disease. So Kamisha is always the one who's ready. When they want to hear from the community, there's this survey going on, you always see Kamisha stepping in and, hey, I'm ready, I'm here to help. How can I help? So that's Kamisha for us. We have Janet. I'm sorry, there's a typo here. So Janet is also a voting member from PAC. She has always been very passionate about sickle cell disease advocacy, as her younger sister was born with the disease. She holds a Bachelor of Science in Nursing and currently works as a registered nurse in respiratory unit. Her passion for sickle cell disease advocacy goes beyond volunteering at SCAGO. She would oftentimes educate her peers and colleagues on the disease whenever an opportunity to do so arises. And that's later than last week, I believe, when Erlene shared some posters where they were asking sickle cell disease people to get involved. Janet, we have two Janet actually. So one is Jane, as you could have seen. That's how we differentiate. Janet was the first one to go. Like, do I have to share it? What do we need to do? So always there to support the community. And here we have Herline. Herline is one of our new coming members. She's a voting member. She's a peer and passionate volunteer supporting SCAGO with education program, outreach, and now with the PAC. She has a Bachelor of Arts in Mass Communications and Political Science and a certificate in radio broadcasting. In her spare time, she enjoys music, family, friends, and volunteering in her area of the GTA. We are hoping for Arlene to use her administrative skills with PAC. And as you can see, like whenever there's something, she's there already putting stuff together, saying, hey, I had the time to go through this document, verify this. So we really appreciate Arlene's contribution to PAC. And Gabrielle Badejo is one of our future members will soon joining the PAC. Gabrielle is a peer, today sickle cell free, thanks to a bone marrow transplant. He's a documentary and filmmaker based in Toronto. His involvement in sickle cell awareness campaigns, participating on panels internationally, and serving on the Ontario Health Quality Standard Committee underscores his commitment to making a difference beyond the screen. I believe you had the opportunity to see him at the Sickle Cell Disease Summit. He was also once a speaker at one of the peer support sessions that we do monthly. And definitely we are eager to see how it will also be supporting the PAC. Dr. Saul. So Dr. Saul is a non-voting member. He's an hematologist and transfusion medicine specialist at the London Health Science Centre and an assistant professor at the Western University. He currently directs the Adult Red Cell Disorder Hematology clinic at the LHSC, where he sees patients with sickle cell disease and thalassemia. And he's the head of the transfusion medicine division in the laboratory and also act as an advisor at the PAAC. He's really the one who guides us when it comes to those more of the technical, if I would say, or medical aspect that we go through. For example, where we were and I'm starting already talking about project, but it was the one enlightening us when we were to complete some survey regarding the CAS-JV treatment, explaining just breaking it out to us, helping us providing more informed decisions. And then Mrs. Lanry. So Mrs. Lanry, for those who don't know her, she is the CEO and president of the SCAGO. She is also a non-voting member on the PAAC. She is a global patient advocate for the sickle cell disease. As the co-founder of SCAGO and Sickle Cell Disease Association of Canada, she has significantly raised the visibility of sickle cell disease in Canada. Our efforts include advocating for newborn screening, securing funding, and influencing health policies. She is also recognized for her leadership with several prestigious awards, and one was not far under 27. She just received an award from the primer, so definitely we are proud of our Mrs. Lanry. So let me just pass to Jane. We'll be talking about PAAC goals.
Thank you, Tanya, so much. Thank you, everyone. Tanya is very humble about the many hats that she wears with SCAGO, but she has been very instrumental in just in keeping us together and keeping us focused and on task. So I just wanted to make that important note. Yeah, so part of our goals, our main goals for PAAC is to promote the health of our community, to promote the health of our loved ones and ourselves, to reduce the pain and suffering experienced by peers, and as well as their families, helping families affected by the disease to have improved quality of life and standard of care. And we also sit on different hospital advisory boards to ensure that patients in Ontario are receiving optimal care from the hospitals. So in a way, I would say it's a way of keeping our hospitals accountable in terms of the standard of care and and we support SCAGO's vision in ensuring Ontario families and clinicians have equitable access to existing and emerging therapies. And there are I mean, there's a lot to be said about that, but it's exciting to see to hear and witness all the new gene therapies that are in the works through Ontario Health, through the Ministry of Health, rather, sorry, and what that means for our loved ones and us for the future of the disease. We also support by ensuring that Ontario families have access to tangible education in sickle cell disease. There's also improved access and participation in clinical trials and research, such as I think one of the recent research that we did was in vaccine equity. That was during COVID time, and how that information was being disseminated and how the vaccine had an impact or yeah, had an impact on our community, and also to support the development and dissemination of guidelines to advance quality standards and care for sickle cell disease. And that's through we have the Ontario the Ontario Patients Guidelines. Oh my God, this is bad that I can't remember what it's called, Tanya, but
Health quality
the
standard for
health quality
Ontario Health.
standards, yes, sorry. Um, and so that's the sort of the our Bible, if you are so to speak, that helps us in terms of dictating the relationship that we have with the hospitals and standard of care. Yeah, I'll pass it back to Lance.
Hey, hi everyone. I am so happy to be here to talk about something that's really important to me, which is the project that PAC currently is pushing forward. So we understand that a part of optimizing care for patients with sickle cell disease is understanding how the current system is working and how to improve. And so we think that the best way to go about doing that is having data to this sort of information. And so PAC has been working towards just getting people to share a little bit more about the experience they have been having within the hospital setting. And so our very top priority right now is to get a sense of hospital experience for patients. So whether you are a patient yourself or you are a caregiver, and you have been admitted to a hospital within Ontario, we'd love to hear what that experience has been like, whether it's positive or not so positive. So the reason for this is we will be better able to strengthen our advocacy for improving the quality of life of patients and even just ensuring that hospitals are adhering to the quality standards that we spoke about that has been implemented. I understand too that hospitals' funding has been tied to the quality of care that patients are receiving. And so the more that we are able to understand how patients are being treated within the hospital in terms of the time that it takes to receive medication, the knowledge of the healthcare provider, information related to how we feel. Is it that we felt discriminated against? Did we feel that they respected our dignity? All of those things are good information for us to have. And we invite you to share that with us. When you go on our website, you can see the hospital experience reporting portal. The second activity or project that we are pushing is advocacy for international students with respect to the insurance coverage being offered by post-secondary institutions, whether college or university. The reason this is so important is we have noticed that many patients from international countries, whenever they come in to study, they are not given the full story about the limitations of their insurance scheme that is offered by the university. For example, many of these universities and colleges, the insurance do not cover pre-existing health conditions. And so sickle cell disease is likely to result in hospitalizations. And then when patients show up to the hospital thinking that they have coverage, unfortunately, they are hit with bills that are quite high, for example, within the thousands, depending on how long they have been hospitalized. And so what PAC is trying to do is we are advocating for um, colleges and universities to share that they talk a little bit more, be a little bit more specific about the conditions or the structure of their insurance scheme so that international students can make more informed decisions. it really is unfortunate that we are stressed out and we are hospitalized, and then we get hit with this astronomical bill. So the more we can have patients become informed about what their options are, the easier it will be. In terms of the other project, we do stress the need for advocacy scripts and templates. This speaks specifically to what to say, how to say it, and how to get physicians and other healthcare providers to just be able to support us. Sometimes we feel overwhelmed and we are not always empowered to advocate for ourselves very well. And then they mislabel us as angry or drug seekers and so forth. So the advocacy script is a way that we are trying to create a common language so that we can improve advocacy for our patients. And then, of course, we are always ready to review and to provide input on any sort of policies that are specific to sickle cell disease. So we talk about, I think Gabriel is a part of the Quality Standards Committee, and there are other projects that are trying to establish policies to support optimizing care for sickle cell. And so we serve on those committees, we give our input so that those policies are specific to our needs. And then finally, we are participating in hospital working groups and patient councils. I understand that hospitals in Ontario, they have specific working groups for specific conditions, and they have many patient councils because they want to add the patient's voice to the policies and the procedures within the hospital setting. So PAAC serves as um, members of these working groups and patient councils. Thanks.
Sorry, I was on mute. Thank you, Lance, for this. So now I'm passing to Fitzan.
Good morning, everybody. Thanks for having us. Thanks for sitting in and listening to us. So how to connect with PAAC. Feel free to send us an email at PAAC, PAAC at sicklecellanemia.ca. We do deal with more systemic things and more group-related things, as Lance was mentioning, the international students or hospital working groups. But if you do have an individual, we have received individualized messages with people going through the hospital system and things that are happening. You can send those as well, and we will make sure that they're received by the right channels, whether it's the GTA support or even just sending it through to Miss Lonnery so that she can help you advocate through hospital portals and such. But feel free to send us an email, whether it be with feedback or an ongoing issue that you face, and we will try our best to make sure that it is on the top of our agenda and that we work through it the best way we can.
Perfect, thank you. And now we'll be just sharing with you some of useful resources to relate it somehow to the PAAC, but also how SCAGO do support the community. So the very first one is you can, we'll be sharing those the slide deck with you. So you'll have handy those links that we are sharing here. But you have here a link that will brought you directly to the PAAC. So to learn more what you heard today, but consult it on the SCAGO website. Sometimes where if you want just to recall what was shared, you'll have access to it there. The hospital experience reporting portal that Lance talked about. We had a session last month where we actually presented it and showed how it works, how people can complete those. And also we wanted people to understand that as we are starting with it, we want it to be like to develop new habits. So when you have to develop a new habit, just reminding people that it exists, and it exists not only to share complaints, but also to share a good encounter. Oh, I was to the hospital today. Oh my God, they received me like a queen. Like it's been a while that I have not been treated this way. It's such and such hospital. This is good as well for us to go back to them and say, hey, good job. People are noticing that you are improving. So, but of course, if you received a treatment that was not optimal, you spent 3 hours before receiving an analgesic, you were not addressed properly, we want to hear those stories as well. And this will help us when we go back to hospitals, when we go back to government to ask for more support or to ask for policies to be updated. At least we have numbers. We can come now and say, hey, like 10 people or 15 people saying the same thing is not just a matter of fact. Like there's something there, please look at it. Definitely one of the project that is dear to PAAC is the lack of adequate information on insurance policies provided to international students. That was one of the projects I mentioned as well. So there's an article here that explains completely what this project involve and why we want to address things there. Again, we also want to have facts and data with this. So there's a survey that has been up for a few time now, and we really want to encourage folks. You have been an international student or you are currently, so even if you have been in the past or you are currently, and you know that while a student, you faced some issues with your insurance, you were hospitalized and unfortunately, the insurance said, oh, you are covered, but no, we're not covering this because of your sickle cell. Those are the stories we want to hear through this survey. And this will give us also numbers and say, hey, look at all those people that have been affected by this issue. So they will see that this is an important topic that we need to talk about. And those are, for example, just to mention how PAC received those from everywhere. So this one, for example, was the doctors from London, both the social worker and Dr. Saul, that rang the bell and said, hey, we're noticing something here that doesn't seem to be okay. Like we as the hospital, unfortunately, nothing we can do, but PAC, can you come in? And that's where we stepped into that project. Also, the Ontario Sickle Cell Disease Quality of Standard that was mentioned, you have the link here. It's good for you to go through it to understand. These are with what like the Ontario government heard us and said, okay, we will now come with something for hospital to understand this is how you should treat sickle cell disease patients. So this standard, if you don't know them, it will be difficult for you to go to the hospital and even understand, am I being treated well or not well? Because for you, it could be, okay, I know that I'm hearing that people spend 24 hours in the hospital before being seen. If I'm seen in 1 hour, it's okay. No, for sickle cell disease, you come with a crisis, a pain, like they need to address you right away, that part of the standard. So if you don't know the standard, you won't know how to advocate for yourself. You won't know how to go and say, hey guys, there are standards that exist. You can even show them. How come I've been here, I'm crying for pain, nothing, and sometimes you're in pain, you cannot talk to yourself, but the person with you, the caregivers, we are there as well. It is important for us to know that. I've been with my sick child here. We've been sitting for a while. Nobody seems to care for us. What do you do about this? This is not SCAGO deciding. This is the government. So please pay attention to that. So you have the standard here. And also support available at SCAGO. So we introduced at the beginning of the call the well-being coordinators. Those are very great supports that was created for SCAGO. GTA, we had Samira that you met at the beginning, Windsor with Tasha, London with Maya. I'm not sure if Maya is on the call. And soon also Hamilton and Ottawa will be the next to benefit from this support. I cannot tell you I know that Stasha Maya recently joined. Samira has been around for a while, but I believe people from GTA, there is no one that would say, I've never heard this name. I heard it somewhere because she's everywhere, always there to support. They are your people. They are there for you. When the social worker, unfortunately at the hospital, meets her 9 to 5 and need to leave, Samira is there. She will call. She will reach out to know how was the care. What do you need? Even after those after typical after hours, they are there. So. Don't hesitate to use them in the proper way. There are cards in the hospital explaining their role, how to contact them as well. So by any means, that do not hesitate. They are there to support you, to advocate for you, also to provide you with some information that you may need while you are in the hospital and even after you leave the hospital. And of course, we have the counseling portal. Oh, before,
Tanya, yeah, could we interrupt you? I'm so glad you raised your hand, Samira. I didn't want to put you on the spot, but maybe you can share a bit more, if Tanya does not mind at this point, about our coordinators and how to reach you.
Definitely.
Yeah, so our role is pretty vast. I would say we kind of act like an extension of support within the hospital. So we ensure that patients are connected to the right resources before and after discharge. And then we also follow the patient from the hospital and into the community because we want to make sure there's that wraparound support. And as Tanya also mentioned, the hospital experience reporting portal, like for me, actually all of us, we have a lot of situations whereby we have to intervene to advocate for a patient. Let's say, for example, you're waiting there in the, admissions or ER for 3+ hours, right? And they're not tending to you, or they're not giving you medication. That's why we are an external community-based support where we intervene and we can help to advocate on your behalf once consent is provided. Because we do understand when you're going through a vaso-occlusive episode, you're in a very vulnerable position, and some people don't even have the energy to sit there and argue with healthcare professionals, right? So one of our role is to intervene and be there with you, right? Be there to support you and advocate on your behalf. So we do want to, make sure that you guys understand that that resource is out there. We don't just provide that psychosocial support, but we're also there to advocate if you need that. And we're there within different regions. I do GTA, Stasha does Windsor, and then we also have Maya, who just recently got recruited in London region. And she does work directly with London Health Sciences, where she meets the patients and the patient knows that role exists, and they reach out to her if they need support in admissions or if they need support being connected to resources outside of the hospital, because the hospital usually does not provide that wraparound support. They only help within the hospital, right? Once you go into the community, you don't have that wraparound support, but that's where our role will intervene and provide that for you.
Perfect. Thank you so much, Samira, for adding this. And as we said, do not hesitate. Of course, you don't have the emails on this slide, but like I said, your hospitals, if you're in GTA, Windsor, London, do not hesitate even yourself to ask, hey, I heard there's this position, I heard there's a card, there's this. They will be willing to provide you with those. And also we have the counseling portal. I believe most of you, some of you may have used it in before. So this is actually a portal where you can come if you want, you need support, sorry, you need support on the psychosocial side. So there's an intake form there where you complete and you share what you're experiencing and how do you need support. And Dr. Newton will be happy to support you with that. And I don't know if you want to add something on that, Dr. Newton.
Sure, I'll say a few words. Thank you, Tanya. Yes, we've had this arm of SCAGO support available for a while. And although we are limited maybe in the number of sorts of sessions we can provide, the intention is really to be a place that you can reach out if you are in need of some support. Can be counseling around a specific issue. It can be a need to be connected to other mental health supports. Of course, contacting our well-being coordinators is also a route to those referrals. They also do a form of counseling, but just as a psychologist, it's been something that I've been happy to do, whether for children, teens, or younger and older adults. So That's really what I wanted to mention. It's usually a limited number of sessions just because of our resources, but at least an opportunity to connect with you, problem solve, and let you know that we are concerned about your total well-being at SCAGO. Thank you.
And Mesa, I don't know if you would like to talk about our exciting upcoming events.
No, never. This is my favorite time of the year. I love hosting and planning the Christmas parties, and I'm doing a lot this year, and I think everybody else is too, because this year we were fortunate to book some special places instead, somewhere in a basement. Um, but yeah, every region is having a Christmas party. Let's see. Windsor is December 13th, and I can't see who's the next one.
GTA.
GTA. Where does it say GTA?
On the poster, yeah. But
Oh,
maybe,
it's
yeah.
quite small. Okay, so that's also December 13th. If you're in Hamilton, December 20th. We're almost at full capacity, by the way. So if you haven't registered, hurry up. London is December 20th, and Ottawa is December 20th. So the good ones are having it later. Samira. But yeah, so there will be food, entertainment, and a little gift, not a little gift, a gift for the little ones, I should say. So come out with family, friends, and yeah, it's a great way to spend some time together away from the hospital and the noise and all that stuff. So if you haven't registered, register.
The links are up there. Like Mesa said, it's filling up very quick. So unfortunately, we would love to have 1,000 of guests, but sometimes it's not possible. So yeah, I believe even the GTA, I think although we displayed the link, but I believe when you click on the link, they said that they're at full capacity now. Oh, I'll let Samira say some word for that.
Yeah, I had to close it because we were like going over capacity. But what we're gonna do is we're gonna call everyone that signed up and verify if they're coming, so then I can open it like 5 days before, and other people can join if we have space. But yeah, it's gonna be really good. We're gonna have gifts. I think we're bringing like a pancake venue and ice cream, and Santa Claus is coming. It's gonna be temple. And yeah, we're gonna have a really good time. So we would love to have you there. Also, Misa's coming too, so you'll get to see her. Bonus. That's what you can.
I can't back out now, can I?
Yes. So I had to put her on the spot, but yeah, it's gonna be a really good time. Yes, Janet,
I'm not gonna
Claus.
be Santa Claus though, for sure, right?
No, I won't do that to you. It's
Thank you.
temple. Yeah.
Thank you.
Stasha, I don't know if you want to add something for Windsor.
Yes, so when it comes to winter, we have our party on the 13th. We are going to have um, like that organization help us with kids activities. So we are currently still thinking about activities for the grown-ups. We have some ideas. We still have to hammer it down next week and see which activities are we going to do for the grown-ups. So far everything is going well. We have secured the place and food and all of these things. So yeah, just moving along.
Perfect. Thank you. Thank you all. Thank you for bringing us already there, but we have to focus back and come back to what we were talking. We were already thinking partying and everything. Yeah, so some of the closing remark for today. So just a reminder that the PAAC is here for you, for us. We support the sickle cell disease community by gathering and sharing your experiences with SCAGO, addressing concerns from hospital care to daily life. So this ends the formal part of the presentation. Thank you again, Janet, Fitzan, and Lance. Now we will be opening it up for the Q&A session. Like we said, we will be stop recording from here because maybe during the questions, some people may have sensitive subject that they want to share or personal stories. We respect that. So we will be stop recording here and we open the floor for questions. And I don't know if there were